So clearly we are monitoring testing outside the northern beaches because as we've got quite tight restrictions on the residents of northern beaches, it is really our focus from public health response is to ensure that we're not missing undetected transmission in regions and areas outside of the northern beaches. We're particularly focused on those where we know that positive cases have been and around those venues that we have identified on our website. The advice we've had is that testing numbers have been higher in all other areas, and we're waiting for the data to come in and be cut, and we will closely monitor that levels. But the preliminary information we have is that we have seen testing surge across the state. And can I thank every one of the people that have come forward for testing. Now, testing alone is one of the critical elements we need. So anyone with symptoms, please get tested. And I'm particularly stressing for that statewide. Don't just think this is a Northern Beaches issue. We need everyone to help us detect any undiagnosed transmission. Also, we're supplementing that by our sewage surveillance. And again, I'm asking people not to rely totally on the sewage surveillance, but it is an important adjunct. And we are monitoring that closely, particularly across regional areas and across metropolitan Sydney outside this, obviously where we've got these active cases. So the things that we're looking for over the next couple of days is the number of cases that we're reporting that have already been isolating for the full period of their infectiousness. And that's a measure of the effectiveness of our intervention. So if we are getting cases and all of those cases have not been out in the community in their infectious period, it means that they then cannot be on spreading the disease and the disease risk has been stopped.